We are continuing our discussion on the coronavirus or COVID-19 pandemic. And since the holidays, new case numbers are rising again, due mostly to the Omicron variant, both throughout the country and here in Orange County. Many residents are questioning what we should do next. Orange County government is once again recommending wearing face masks. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals. And joining us is Alvina Chu, Director of the Division of Infectious Diseases with the Florida Department of Health in Orange County. Alvina, thank you as always for being with us today.
Thank you for having me again.
So, suddenly there is the Omicron variant. Where are we as far as the numbers are concerned here in Orange County and in the state of Florida?
Well, unfortunately, I have to report that we are seeing numbers higher than we have ever seen in this pandemic previously. So previously we discussed about what a high level of transmission is per, the CDC definition on their scale from blue to red. And so the categories for red are incident cases or new cases for a 7-day average per 100,000 population is 100, and for percent positivity is greater than 10. And so just this past week, we have reported an incidence rate of 1,877 per 100,000 population and a percent positivity at about 42%. And so we are at an extremely high level of transmission within our community right now.
So we're seeing this higher transmission. Is it because of different characteristics of this Omicron variant that the transmission is so high?
Potentially so. So we do know that the Omicron variant has some mutations on its spike protein that may allow it to be more infectious. The other factor to this is, the holidays just passed, so an increased amount of, human interaction in a lot of closed spaces or potentially large groups, and when we're with our family, of course, we let our guard down a little bit. It's hard to, wear a mask all the time or watch your distance when you haven't seen close family in a long time. The holidays are a time for gatherings. And so in this post-holiday season, we did anticipate, and we are now seeing this increase in cases.
And even though we are seeing this increase in cases, we're not seeing the same proportion of hospitalizations as we did in previous variants that we've had. Is that the case moving forward? Is it because of the vaccines? What are we seeing? Why are we seeing the difference?
Of course, an answer like that is also multifactorial, but one part of the difference that we have now that we may not have had before is vaccination. And so we have some good vaccination coverage within our county. And so trend-wise, we're seeing this concurrent increase in hospitalizations, but not a concurrent increase in severe illnesses. And so the hospitalizations with an ICU admission and those on ventilator use, it has not seen any significant increase thus far. And so this is the story that's out of other places that are also going through their Omicron waves or their peaks, is that potentially not seeing severe hospitalizations.
And one of the differences in the hospitalization that we're seeing now is the larger percentage of children who seem to be being hospitalized after they contract the Omicron variant. Is this more affecting children more than it is adults in some ways?
Yeah, so also multifactorial answer. So there's a lot of infections happening, and so proportionally, this variant or the current wave of infections is not affecting children more. What we're seeing is a volume increase. So because we are having so many more infections than we previously did, we are seeing that number reflected proportionally in children. Also, we currently have good vaccines for children who are 5 and up. And actually, our coverage for vaccination in children for COVID-19 is not as good as our coverage for adults. And so one factor that may play into this is that the virus is now infecting people who are not yet vaccinated, which includes children.
And one of the, if you want to call it a silver lining to this whole thing, is that testing efforts have definitely been boosted because people are not sure and are seeking out testing. Here in the state of Florida, here in Orange County, are we seeing the testing supply keeping up with demand?
So the demand is very high, and a lot of that was because of requirements for travel or requirements for work. So during the holiday season, it's also one of our peak travel seasons, and there was the requirement to get testing prior to getting on a plane or leaving the country and coming back into the country. And so we have Orange County government has opened additional sites to try to meet this public demand, and those sites can be found on the ocfl.net or the Orange County government website.
And because of the emergence of the Omicron variant and the number of people who've become infected with Omicron, we're starting to see the CDC has changed some of its both booster and its quarantine time recommendations. What's changed with those recently?
So the CDC is currently considering booster doses for those 12 and up. The boosters have been approved for those who are 16 and up for the Pfizer vaccine. And so because of some waning immunity, because of this current increase of cases, it's recommended that those who are recommended for a booster, so 6 months after their Pfizer or Moderna series is completed, to get a booster dose, and 2 months after the Johnson & Johnson. The recent changes in the isolation and quarantine guidance. So the initial guidance was based on a viral shedding period of about 10 days. And so the current recommendations are really actually still 10 days of precautions, but really the peak viral shedding period would be the 2 days before symptom onset to the 2 to 3 days afterwards. So the initial 5 days is where people are most likely to be the most infectious, and that's where we want people to really focus on isolating or quarantine if they've been exposed and removing themselves away from others so that we can help reduce the amount of transmission.
And just so that we can reiterate for those who've been living on another planet or under a rock, what do we need to be doing to keep ourselves safe and virus-free?
So really the best measure that we have for prevention right now is our really excellent vaccines, which are very effective at preventing severe outcomes, hospitalizations and deaths. And so we really encourage those who have not yet gotten any vaccine, or those who have not completed their primary series, or those who are due for a booster, to get their vaccines to help us reduce the amount of transmission that's here, and also to protect you and your loved ones from potentially severe outcomes. And then our pandemic precautions, which we encourage one to practice at all times, which is the wearing of a face covering or a mask to contain your secretions and droplets, washing your hands, so good hand hygiene, and then watching your distance. And so, giving yourself a little physical space between you and others. And then also trying to avoid large groups or gatherings, where you don't know where a lot of people have been or what their vaccine status is. And also trying to keep, if you are going to something like that, try to have it outdoors or in a well-ventilated space.
Well, thank you so much, Alvina, for being with us and keeping us informed from the front lines of this pandemic. We truly appreciate you, and Happy New Year as well.
Happy New Year. Thank you.
And we'll be right back with more. Stay with us. We know that the Omicron variant is now the dominant one throughout the country, as well as here in Florida, and it's also produced a troubling rise in hospitalizations among children. Dr. Thomas Lacy, Medical Director for Florida Primary Care with Nemours Children's Health, is here to explain more. Dr. Lacy, thank you for being with us today.
Thank you for having me.
So what is causing the rise in hospitalizations during this round of coronavirus with the Omicron variant and its effect on children?
Yeah, it's a great question. First of all, so many more people are sick right now. Just the sheer numbers of people with COVID is much higher than it's ever been. So when you have more people sick, you're going to have more people seriously sick as well, and more children. More children are sick, more children are seriously sick. But what we're also seeing Of course, unvaccinated people are much higher risk at hospitalization. Just in the teenagers, if you're unvaccinated, you have 11 times higher risk to be in the hospital than if you're vaccinated. So the combination of being unvaccinated, as well as we're seeing children with co-infections. In other words, they have COVID, they may have influenza also, they may have another viral infection. So all of these things together are causing the rise in hospitalization in children.
And is it true that the symptoms with the Omicron variant are less severe, or is that with vaccinated people versus unvaccinated individuals?
In general, the symptoms are less severe, but they're definitely less severe in vaccinated people, especially if you've had that booster shot as well. So clearly, the vaccination and the booster to the vaccination causes the Omicron to be more of an upper respiratory illness and more of a minor illness. The people who are getting significantly sick with Omicron are almost universally unvaccinated.
And how are the hospitals here in Central Florida handling the demand?
They're increasing their staffing. A lot of the hospitals are not quite as busy as they were at the worst of the Delta surge back in the summer, but they're getting that direction. And because we feel like the Omicron surge has not peaked yet, we are worried about the next 2 to 3 weeks because we feel like things are going to continue to go up for another week or two.
And as those numbers go up, a lot of concern because children are disproportionately represented as among the hospitalized. Why is it important for children particularly to get vaccinated against a coronavirus?
Well, it's important for children to get vaccinated for two reasons. One, to protect themselves, because again, we know if you're vaccinated, your chance of being seriously sick is much less. But children also spread the disease more to everyone. And we know that if you're vaccinated, you don't spread the disease as much. So children really, whether it be influenza, whether it be COVID, it's important they get vaccinated to try to help minimize the spread.
And are children being given the same vaccine that adults are given?
Yes, they are. If you're over 16, you get the adult vaccine. The kids who are 12 to 15 get a slightly lower dose than the adult dose, and so, but it's an effective dose, and that's what the studies have shown. What the correct dose is to get immunogenicity in the younger children.
And what would you tell parents who are leery about having their child vaccinated and are just a little bit leery about the safety and efficacy? What would you tell them?
Sure. Thank you for asking that question. It's a very important question. And I've got 6 kids, so I totally understand as a parent, you don't want to do something that hurts your child. But in this case, not doing something could hurt your child because clearly the vaccines are safe. We know that from the literally millions and millions and millions of vaccines being given around the world. But we also know that the unvaccinated are those at high risk for disease. And I want to also add that, as I mentioned in the beginning, a lot of the children we see who are seriously sick have co-infection. In other words, they may have influenza and they may have COVID at the same time. So getting your flu vaccine is critically important as well so that you don't get 2 infections at one time, because those things seem to be worse on children and adults in all likelihood.
Well, Dr. Lacy, thank you so much for being with us today and keeping us informed from the front lines of this pandemic. We really appreciate your time.
Thank you. And remember, masking is super important at preventing infection, both spread and getting infected as well. So masking is critically important in addition to getting your vaccinations. Thank you.
Thank you. And we'll be right back. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And of course, we are also here to help you keep making those healthy connections. Stay safe.